Several stakeholders met at the Ministry of Health corporate headquarters in Port of Spain to launch a national health research agenda. The objective aims to bridge the gap between research and reality in the health system. Professor Donald Simeon, who works at the University of the West Indies Faculty of Medical Science and Caribbean Center for Health Systems Research and Development, said the gathering on Wednesday intends to find out what the Health Ministry needs to guide its policy development.
Everybody's actually involved. The Ministry of Health is one of the leaders in the process. All the RHEs are also involved, CSOs. And it's about targeting research being conducted at the universities, UWI, USC, UTT, for example. What we have found is that researchers have their own agenda. They research what they want. The Ministry of Health says that, they need evidence, but they don't get it from the researchers.
Research assistant Ms. Alyssa Moore gave an idea of how the draft agenda was developed. She said the Health Ministry was the one that pinpointed the focal points for the strategic research priority areas.
And the aim within the working groups were to determine if there were existing or relevant data or research evidence to address the ministry's needs, to develop research questions, identify study designs, brainstorm funding opportunities, establish collaborative teams, and develop a follow-up plan.
Speaking in the absence of Health Minister Terence D'Alting, Research Officer Cindy Ciudas gave an overview of the priorities.
So the Ministry of Health, as we all know, provides leadership and direction for the health sector by focusing on policy making, planning, assessing the policy's health needs, mobilizing funding for delivery of health services, and regulating the sector, and also ensuring that the necessary services are available to the public. To do all of this, we need research to provide the evidence for our decision-making plans and programs.
Apart from Trinidad and Tobago, Jamaica is the only other country in the Caribbean that has a national health research agenda.